Week 3 continuation of the head to toe assessment. First, I wash my hands. I don my proper garb. I wear my mask and gown, and I introduce myself to the patient, and I provide the privacy. I explain to the patient what I'm doing. I'm assessing their chest wall, and at this point, this is for the cardiac section, the heart section. I want to make sure that there's no lesions or any discoloration of the skin. I want to notice to see if the patient has any difficulty breathing or any chest pain. I'm checking the level of consciousness to see if they're conscious to name, place, and time. So ask the patient, where are they? What time is it? What is their name? I check for the skin and notice that the skin is warm and dry. The skin color was normal. No lesions, no body art, no tattoos, no masses. There was no clubbing of the fingers. The normal pink normal pink moist palpebral conjunctiva. I palpate the carotid arteries and note that the rate and rhythm are normal and regular. I use the bell over the carotid artery. I hear no bruits. I check for the JVD. There is no JVD. JVD, otherwise known as just jugular vein distension. This is when the CVP increases above a normal or healthy level. This can be caused by several conditions, like right-sided heart failure, pulmonary hypertension, tricuspid valve stenosis, SVC obstruction, constrictive pericarditis. Patient did not have a distension. No apical pulsation was observed. No lifts, no thrills, no heaves, no vibrations. I feel for the angle of Lewis. I hear the lub-dub pattern. I notice that I listen to the 5 pericardial heart sounds. For the S1 and S2, I start with the aortic, the first intercostal space, and I notice that the S2 is heard louder. I hear the lub-dub. The dub is louder. The second intercostal space of the pulmonary valve. This is the lub-dub. The dub is also louder here. Then the third space is the Erb's point. There's the lub-dub, but there's no valve here. I go to the fourth intercostal space of the tricuspid site. The fifth is the mitral valve. I use the diaphragm and the bell for the light pressure over each site. I document my findings. I identify the lub-dubs. I evaluate the heart for the rate and rhythm. Normal heart rate is 60 to 100 beats per minute, and this patient was at 66. So I listened to all the 5 heart sounds. Patient was within normal limits for all of that. I also listen with the bell of my stethoscope for any heart murmurs, the blowing sound, and there was no murmurs. The cardiac region seemed to be within normal limits. End of cardio.